So thank you very much for taking the time to join us today for this episode of the GWOPA's coronavirus webinars. This one is called Slowing the Spread in Slums. And we're very happy that you're able to join us here to see this webinar that we were able to put on with the help of our many regional platforms and other technical partners like UNICEF and GIZ. So the topic of today's webinar is what utilities are doing to protect people and reduce transmission of the COVID virus in informal settlements, as well as other vulnerable communities, like including prisons and migrant centers, but also to other vulnerable populations that are not necessarily geographically concentrated, like homeless persons or those for whom affordability is a barrier to access for wash services. We know that hand washing is the very best way to prevent the spread of this pandemic, but about a third of the population globally is not able to wash their hands because of lack of water and sanitation. Informal settlements or slums are home to around 1 billion people worldwide. About half of Africans are living in this kind of a context. Overcrowding, poor housing, insecurity of tender, lack of access to basic services are what defines these kinds of settlements, and also make things like social distancing, which is the other way to protect against the virus spread, quite infeasible. Informal settlements facilitate very rapid transition, and then the underlying vulnerabilities of the population, health conditions and other factors, put those inhabitants at greater risk of catching the virus and then falling victim to it, becoming ill. So there's both, deeply moral, but also strategic reasons to pay priority attention to these areas at this time. At this moment, as COVID is moving slowly into communities of the global south and more quickly in some places, there's a very coordinated response in many places with governments and water sector actors trying to mount unprecedented efforts in many places to ensure that water and soap are in the hands of everyone in an effort to stop the spread of this virus. So we want to hear today about what water utilities are playing. They're playing an important role in this, and there are many actors involved, but utilities are doing quite a lot. And so we want to hear from them. At this kind of moment, we've noticed that utilities are turning more than ever to one another to look for solutions and ways to address this challenge. And this is what GWOPA does. We're all about facilitating peer support and learning between utilities. And so we're happy to work with our partner organizations to enable this kind of an exchange, both here, but then also further on online, and also through more dedicated one-on-one peer support partnerships. So let's just look quickly at the program before we begin. If you could go to the next slide, Craig, could you share your screen there? Thank you. The next one, yeah. Just a quick overview of what's going to happen today. I am your host. Sorry, I didn't introduce myself. My name is Julie Perkins. I'm from GWOPA. I'm the OIC of GWOPA at UN Habitat. We're very fortunate today to have Leo Heller, who is the Special Rapporteur on the Human Rights to Water and Sanitation, who will kick off with a keynote presentation.
So the question is, when we look through this lens to the coronavirus pandemic, what do we see? I would say that the first issue is the verification that the pandemic is not democratic. They are less protected, and Julie raised some of these reasons earlier today, and they have less access to water for hand washing. It's harder to be isolated. They have less access to health facilities, to intensive care, etc. So they are certainly most affected. And one question that we can ask is, what are the roles of the service providers in this context? How water and sanitation providers can support the containment of this pandemic. And I would say that the main issue is to identify and to focus on those people that are most disadvantaged, that are living in poverty, and that have less access to water, mainly to hand washing, because we know that hand washing is one of the most important primary barrier against the spread of the disease. And so based on that, we need to pay special attention to some groups and to some areas. And of course, slums and informal settlements, as is the subject of this webinar, are very key in these aspects. We need to remember, we need to remind that land tenure cannot be an issue to discriminate people. If people live in slums without land tenure, the providers can't refuse to provide services to them. So the issue now, and I'm very curious to hear from my colleagues panelists, what they are doing to provide services in those areas, in those contexts, because in some of those slums and informal settlements, there is no proper water supply, and it's important in this moment to provide in any way, with alternative interventions and some kind of interventions, proper water supply to them to ensure hand washing in order to protect from the spread of the disease. Another group that deserves a very attentive role from the providers are people living on public spaces. I'm very, very concerned about the access to those people to water for hand washing. Usually they have definitely no access. They rely on favors from the commerce around them. And in these challenging times, it's very hard for them to get water. So please think on this group of population and think on alternatives to provide sinks and other types of devices to ensure for them to have a proper hand washing.
I'm now introducing you to Graham Alabaster, who is our colleague, the head of the Geneva office of UN Habitat, to come on as a panelist, I mean as the moderator of this panel, and to invite questions of all of you. And so, welcome, Graham. Are you?
Yes,
are
I'm
you able
here.
to show your video? There you are.
Can you hear me? Yes.
We can hear you, but we cannot see you yet.
Ah, okay.
Yeah.
Not quite sure why my video is not working, but
maybe we can help you with that. But go ahead.
Anyway, no, it's been an absolutely marvelous experience to listen to everyone so far in this. How you've all made this amazing effort to address this problem, which was thrust on us so quickly. And I mean, really, to be honest with you, nobody was expecting this. And, you know, if we look back 3 months ago, all of us carrying on our lives in a more or less straightforward way. It's very interesting to hear the different ways in which the utilities Can you hear me? Can you hear me okay? Oh, you can see me now even. I'm here. Very good. Fantastic. No, I was just saying that it's been a marvelous opportunity to hear from you, how you've dealt, all of you have dealt in different ways with these challenges that 3 months ago were not even our wife's imagination. But I think from a lot of the presentations, there's quite a few common areas coming out. And I think that perhaps, as Leo said in his opening statement, the issue of how we make sure that everyone is served is probably the most important, because, you know, as he said, COVID is not something that it affects everyone, and it has indiscriminately affected the urban poor because of their access to services. So I'm going to ask the first question to some of the panelists. And the question is, has the COVID outbreak really caused an increase in service coverage to some of these areas? So has the pandemic actually caused you as utilities to look more closely at service provision in the low-income areas and see how we can address a problem which actually has been there before the COVID crisis? So I don't know who would like to ask, who would like to answer that first. Maybe can I ask Ednick from Etiquette? Or if he's not ready, anybody else who could answer first?
I'm here.
Ednick, what are your thoughts on that? You told us about this amazing program you've got, but do you think the actual level of coverage as a result of the pandemic has gone up?
I think so. I think it's a positive spin-off from COVID, because we had a plan for the next, whatever, 10, 15 years that it would have taken us to clear what we would refer to as backlogs. So we would have eventually got to these communities. But COVID is effectively saying to us, we can't wait 10, 15 years. We've got to do something now. So we are going to have to innovate and find ways to now get there quicker than 10, 15 years. And that's what we are doing on the research side of our business, trying to find other technologies. Because if we wait for everyone to have the Rolls Royce, then we have to wait those many years. So we're going to have to be innovative, find cheaper ways, but acceptable, that will still take people out of poverty and deliver the services that they require. So that's what we are doing now. We're going to have to shorten the period somehow. They are covered now, but it's really basic service provision that we are doing now. But we're not going to leave the areas without giving them something else that's acceptable.
Okay, thanks very much, Nick. Can I also ask Mujiaman from Surabaya what your experience is? Do you think this has also increased the service coverage amongst the low-income residents?
Yeah, for Surabaya, now the coverage around 99%, almost 100%.
Wow, that's fantastic.
We have starting from the last 2 years, we really promoting for the people to get the connection very cheap. The poor people can access the connection only to pay around $10 US. This make the people happy to get the connection. That's Graham.
Thank you very much, Mojiman. Can I now turn to our colleague in Jamaica, Mark? Do you think that this is actually, this COVID, if somebody could say it has a silver lining, do you think that this has actually resulted in some of your disadvantaged communities receiving more services?
It does, yes, it does. I think what would have happened is a bit more consistency would have translated from the COVID pandemic in these communities, and there is now even more interest to become formal customers from these communities as well.
Okay, thanks. My second question really is around disconnection policies and revenue, because many of you have said that you quite rightly have put in place a non-disconnection policy to protect the most vulnerable. But on the other hand, you have to face the losses of revenues, which, yes, I would say probably some utilities can manage in a short time frame to deal with that loss of revenue. But if this COVID crisis stretches much longer period, and we know that the economic recovery is going to be slower, what can we do to work out how to maintain the service levels as utilities, and to ensure that at least there's some revenues coming in to enable you to maintain some levels of service? So if I could ask, first of all, Alejandro from Buenos Aires, what are your sort of long-term thoughts on the revenue issue? Over.
Bueno, Graham, a ver, te contesto. Por un lado, sí, es cierto que hay una baja en la cobrabilidad del orden del 30% en el caso nuestro. Por otro lado, el gobierno nacional sacó una serie de decretos y disposiciones, y una de las cuales es la prohibición del corte de servicio, con lo cual no se está cortando servicio a ningún cliente por un tema de falta de pago. Y un poco también para contestar la pregunta anterior, yo creo que, en mi opinión, la pandemia lo que ha hecho es mostrarnos la realidad que tenemos y mostrarnos la importancia de tener un servicio de agua potable. En el caso de Buenos Aires, el servicio es a través de una red de agua potable con conexiones individuales a cada uno de los domicilios. Eso no se puede modificar en un mes. Lo que podemos sí hacer es tomar acciones que mitiguen, como yo comenté en mi presentación, a los barrios marginales y a las zonas donde hoy no se está llegando con el servicio, a través de servicios alternativos, como son la distribución con camiones cisternas y otro tipo de mecanismos que estamos utilizando. Me parece que lo más importante de todo, porque sería irreal pensar que desde que llegó la pandemia se pudieron extender redes o construir nuevas instalaciones. Eso no es así, no existe, sabemos que no es posible. Pero lo que sí para mí es muy importante es que es la enseñanza que esta pandemia debe dejarnos a cada uno de nosotros y a los gobernantes, de saber la importancia de poner en el lugar que tiene que estar, la importancia de universalizar los servicios y poder llegar hasta el último de los habitantes del país con una red de agua segura. Por ahí en el chat había algunas preguntas que vi que preguntaban sobre la calidad del agua. En el caso de Buenos Aires, la calidad del agua es totalmente segura, es un agua que tiene todo un proceso de desinfección, además un proceso muy exhaustivo de controles que la propia regulación nos exige. Para que tengan una idea, nosotros hacemos por año más de 1 millón de determinaciones para verificar justamente la calidad del agua, y estamos totalmente tranquilos que el 100% de nuestros usuarios reciben un agua totalmente segura que cumple todas las normas, tanto las normas nacionales como normas internacionales.
Thank you very much indeed, Alejandro. That was a very interesting answer. Can I ask my colleague from Seville in Spain, Joachim, what about your thoughts on the long-term economic recovery and how you can possibly maintain services with a sort of horizon, a medium-term horizon of reduced revenue? Over.
Gracias por la pregunta. Bueno, nosotros, como he comentado en mi intervención, estamos muy preocupados por el tema económico y financiero. Hemos hecho unos escenarios a 3 años para ver la incidencia que puede tener en nuestras cuentas. Calculamos que hasta dentro de año y medio no recuperaremos el flujo de caja, tesorería que teníamos hasta antes de la pandemia, y por tanto durante este año y medio tenemos que revisar pues toda la situación tanto de préstamos al sector bancario como de gastos e inversiones de Masesa, siempre priorizando la continuidad del servicio a toda la población y la calidad de ese servicio. La calidad se consigue bueno, acotando muy bien las zonas infraestructuras críticas, haciendo desinfecciones en todas las instalaciones, etcétera. La continuidad del suministro, pues realizaremos las obras de infraestructura esenciales, prioritarias y mínimas para poder dar ese servicio global. Y desde el punto de vista de los ingresos, perdón, de los gastos e inversiones, estamos trabajando en una escala de priorización de diferentes gastos presupuestarios que tenemos, de manera que obtengamos un ranking y toda aquella partida de gasto o inversión que no cumpla ciertos criterios, pues no la cometeremos hasta después de pasado este año y medio. Otra de las medidas que estamos tomando es recuperar los trabajos internos que estaban antes en manos de proveedores y subcontratistas. Estamos formando al personal en ciertas tecnologías que estaban en manos de nuestros proveedores para que seamos nosotros, personal técnico de Masesa, la que a partir de ahora las realicemos. Otro de los temas que estamos hablando es reducción del salario a los empleados. Esto todavía no está confirmado, pero bueno, pensamos que posiblemente sea una de las medidas porque la situación es bastante dramática y no llegamos a cubrir todos los costes salariales. Actualmente tenemos una cobertura hasta el mes de junio, finales del mes de junio, para poder subsistir. A partir de esa fecha, pues si no se han tomado las medidas necesarias, pues estamos en una situación de quiebra. A largo plazo pensamos que sí tiene solución, somos optimistas. No obstante, durante este año y medio tenemos que tomar muchísimas medidas de contención de gastos e inversiones para subsistir como empresa autónoma y autosuficiente.
Thank you very, very much indeed, Joachim. I mean, I think it's a very, very interesting issue. We also heard from our colleague Ines Queni, Ednick, about the repurposing of staff, and it seems that we will be faced with this in some utilities, that we have to maybe bring some of the services back in-house that were previously contracted out. Ednick, have you got just a brief couple of comments on that? You mentioned you were thinking about repurposing. What would you, if you have any comment to make on that issue? Over.
No, thank you. I think it's really become part of our strategy going forward, because as we are saying, we're not going to recover very quickly from the impact of the pandemic. So we've got to plan for, to me, in my mind, another 6 months at least before anything happens. So we've had to go back to the drawing board, because there was indeed a lot of capacity sitting there, and say to ourselves, look, can we have the same work done in another way without using this internal capacity? And that's what we are going to do. We're then going to have to now look at outsourcing some of that work, so that then we can use our capacity for what is most pressing in terms of COVID. Because what I deem most pressing is being able to respond quickly if somebody says there's no water. Because my take is, in the context of COVID, you cannot not have water. So I think that's a capacity I need, is to be able to respond quickly. So that's the way we're going to go. But there's pressure anyway on the revenue as well. So if I can, it's a catch-22. If I also reduce outsourcing, then it will have an impact on expenditure, because my staff, I'm already paying for them. They're already an expense. So if I can cut out that, so it's a fine balance I'm going to have to try between the two, between being able to respond quickly and also managing the expenditure.
Definitely, and thank you for that. And I'd like to turn just the attention a little bit now. Working in these urban spaces, and particularly working in low-income settlements, we're always looking for ways to address both the technical and social arrangements of how to do that. And we had some very good examples this afternoon. I think our colleagues in Buenos Aires mentioned about using water in bags to distribute in an emergency way. You were talking, Ednick, as well about the use of tankers. I mean, are there any other technical solutions that we can start to look at? I mean, is there ways that we can rapidly deploy, reticulation, low-cost reticulation networks in some of these areas? Or is there an opportunity? Are there any other technical ways that we can explore extension? And the same really applies to the models, the delegated management models that we've seen working in some countries. I don't know who would like to, if anybody would like to comment on that. Can I ask Mujiaman from Surabaya, perhaps first, then followed by Mark, I think perhaps from Jamaica.
Can you help me once again?
Yes, most certainly. Yeah, I was just saying, are there any new opportunities, technical opportunities that we can see to increase the service coverage in some of these low-income areas? We've heard a little bit about, tankers. We've heard bagged water supplies from Buenos Aires. Is there anything else that's on the horizon that we could consider that could be driven by the utilities?
Okay, we support for the poor community using the master meter.
Okay.
Yeah, master meter is a single meter, big meter, but they can extend the connection, and usually we join with the international community and also the local government and the foundation. They can help like Coca-Cola Foundation, and most of the foundation usually want to support the community using the master meter. The meter until the pipe until the meter is in company responsibility, but the extension of the piping, the maintenance, and then the community education, and then the collection, everything, it is due by the we call foundation, something like that. Yeah, we can ask a lot of local foundation and then the company join together to manage the community. It is work here. We have 155 something connection. It is consists of more than 10,000 people using this master meter. That's Graham.
Okay, thank you very much.
Graham.
Yes, Julie, please go ahead.
We have a poll that we're going to launch, and it shouldn't interrupt the conversation. We'll just launch it. Sorry, and people can answer in the poll at the bottom of their screen while they're listening to the rest of the conversation.
Wonderful. Okay, I would just I'd ask. I hope Mark, you can hear me. I just ask if Mark could have any comment about this issue of new technical approaches. Mark, would you have anything to?
Yeah, I think there are a number, well, I wouldn't want to say emerging technologies. They have been tried elsewhere, but one way of addressing some of the deficiency in these communities to look at decentralized services rather than try to connect to a central utility network. It may be useful to ensure improved access to utilize such system that is an easy conversion of air to water. And considering in our space where we have 10 hours per on average sunlight, a solar system of that order, which will also create a disinfection capability, is a useful technology to pursue. However, in these situations, governments would have to step in as well to provide that level of support in terms of the capital outlay in that regard. But there are technologies other than to try to, give access wherein, as you know, to put in a network within some of these communities, it's going to be long-term, let's say a medium to long-term intervention, because again, access is limited, and how do you maneuver within these space is always a challenge. So it's always good to utilize such technology that limits that intervention, but at the same time create access in the shortest possible time. So that would be my contribution as it relates to a possible technological intervention.
Wonderful, Mark. Thank you very much. We're going to split the conversation a little bit in two now, because I wanted to introduce one of my very good colleagues and friends who Habitat has been working very closely with UNICEF, and the Associate Director there, Kelly and Nalo, is on this call, and I'm going to invite her to make a brief presentation. Habitat and UNICEF are working very closely on the issue of urban wash, and I'll let Kellyanne take over from there.
Great, Graham. Thank you so much, and thanks so much to GWOPA, you and Habitat. This has just been such a great opportunity to connect with WASH experts around the world, and I think it's just been such a rich discussion and so impressive to see really all that you're doing on the front lines of this response to keep water and sanitation services to the most vulnerable populations. For UNICEF, we've also been launching a very large response. We've been working on the ground in over 100 countries across all the continents, really trying to see how we can bring water, sanitation, and hygiene into the forefront in support of the health response. One of the things that we've been doing is working together with the World Health Organization on developing interim guidance to water, sanitation, hygiene, and waste management for the COVID-19 response. And I'll just ask my colleague Bissy to put the linkage there to be able to connect to it. And that has some answers around some of the issues with wastewater. But when this outbreak broke out, I really immediately thought of reaching out with Graham, and just the work on and the needs, of course, in informal settlements and urban slums. It immediately came to our attention that most of the guidance that was being produced at the global level would be almost impossible to be able to implement in these contexts. Whether it's because of the nature itself of areas that are overcrowded, that have poor household conditions, that waste management issues could be exacerbated, or lack of household access to water and sanitation. So many of the simple interventions like washing your hands or social distancing would be really difficult to implement. So, as I said, Graham and my colleague Bissy and myself, we came together to develop this guidance, which is a technical note on WASH in informal settlements. And so we're going to be presenting a few of the key messages from this, and also just wanted to thank key actors like UNHCR and Bill and Melinda Gates Foundation also for their inputs on this. So I think really before jumping into the recommendations themselves, I think it's been really important to highlight a couple of the guiding principles that really look at the specific nature of WASH in informal settlements and slums. And I think just really highlighting, as Graham was saying, really understanding the governance, the community dynamics, and really, using a partnership approach, working in these areas. We know that, it's not always the formal service providers, but also services are often complemented by many informal service providers, in addition to important stakeholders like landlords, community-based organizations, women's groups, faith-based leaders, youth groups. All of these actors are really important in terms of making sure, especially that the most vulnerable households and populations populations are reached with services. I think as a second point that's also really highlighted in this technical document that's been developed are the need for really this understanding of spatial information, and that informal settlements and slums are not homogeneous areas, but are very much diverse, and that can be, diverse across ethnic groups, languages, economic situation, in addition to having vulnerable households that might have family members with disabilities, female-headed households. So this need in informal settlements for this kind of mapping of inequalities, but also mapping of risk factors. And I think what we are seeing is that COVID outbreak happens in clusters, and that it's important to be able to kind of understand, especially when resources are limited, how to target those resources to be most effective. And I think just sharing, I think we've all been sharing our personal stories, but I've been spending the pandemic in New York City. I live in a neighborhood that you may know called Harlem. It has been one of the neighborhoods that's been hit. So we have really seen in big cities, that this is really a neighborhood by neighborhood, block by block. The situation might be different. I think just the last guiding principle is, of course, that we need to be very specific about how we're addressing the challenges to water sanitation, hygiene, and waste management. So this note really goes in on these 5 technical recommendations. I think the slide jumped off, but I think those recommendations are there. I'm mindful of time, but I think if you dive into this note, and I think the link has been shared, that there are really 5 key messages, and that this note really provides both specifics in terms of immediate action, and also kind of the intermediate needs and transitions into building back better, and also the continuity of long-lasting essential services. I think many of you have already touched on these, but just to go through them quickly, I think the first one is really about how to incorporate wash service provision in national and city level response plans. We know many of these national plans are developed with the Ministry of Health, with WHO, and so we need to make sure that the water, sanitation, and hygiene are, well positioned, as this is a multi-sector, multi-stakeholder response, and that adequate resources are provided. I think we haven't touched a lot on hygiene, which is of course very closely linked to water and sanitation. I think this has been also an area that is very critical in terms of breaking human-to-human transmission of the virus. So the technical note outlines a number of areas specifically where we need to be looking at making sure that hand hygiene are in place, and also that the messages for risk communication and community engagement are really specially adapted to be effective in informal settlements where, as we've talked about, there's a homogeneous population. I think, the other aspects that we've been seeing is of course, it's not only the COVID, but it's also the response to the COVID that is exacerbating issues of wash. And so these issues with putting populations into quarantine, into isolation centers, require specific interventions on infection prevention and control that also need to be linked with the management of cases. So services in these areas need to be very closely coordinated with health workers and healthcare facility personnel to be able to reach populations that might be infected but in a lockdown mode. I think increasingly, particularly with reopening now coming up in many countries, we're seeing the absolute need to be putting in place, especially hand hygiene facilities in public places, businesses, markets, transport hubs. So this issue of getting children back to school, there are special recommendations around addressing this with safe school protocols. And I think, you know, the last point in terms of ensuring continuity of services has been very much talked to by the utility leaders here, that, you know, this is something that the socioeconomic impacts of the crisis are obviously a tremendous and grave risk to the sustainability, financial and physical sustainability of services, so that just there are such important measures that need to be taken to make sure that wash services are part of these economic recovery packages. And I think just really also highlighting the point about the importance of the care for the water sanitation workers that are really on the front lines of delivering these services. So I think, you know, that gives you, without giving away any spoilers or details of what's actually in the note, I think that lays out a little bit of what we've tried to do with that. And we really hope that this can be useful. This isn't the first pandemic, it's not the last. And so we hope that this can be a great opportunity for, you know, learning and going forward with a building back better approach together. So thanks very much, and back over to you, Grant.
Thank you very much indeed, Kerry-Ann. I mean, it's been an absolute pleasure to work on the and I think this is, as we say, it's an interim note. So we're very keen to learn from you in the utilities how this note can be applied and what we can do to support you further. We're now continuing a little bit with the questions. I was going to actually ask Kerry-Ann, before you go, if there's any particular burning question you would have for any of our panelists. I don't know if there's anything you want to particularly ask, but if not, we can continue with the discussion. Kerry-Ann, I put you on the spot.
Yeah, you put me on the spot, but yeah, no, I think that this has been really great. I think, you know, one question that we would be interested in is maybe on the coordination, and just, you know, to what extent do our, you know, the distinguished panelists, you know, are they coordinated as part of the national response? Do they feel that there's sufficient attention on water and sanitation? And, you know, if not, what would be the things that would be useful for partners to do to be able to support your efforts? Hope that's okay.
Wonderful. Yes, that's fantastic. Can I ask Engineer Alessandro from Buenos Aires first to maybe to answer that question or to give an answer, please?
Sí, por supuesto, Graham. Sí, yo creo que una de las principales cosas que ha funcionado realmente muy bien es este tipo de coordinación. En Buenos Aires está muy coordinado todo lo que tiene que ver con el accionar del gobierno, de los distintos gobiernos, el gobierno nacional, el gobierno de la ciudad de Buenos Aires, el gobierno de la provincia. Hay que tener en cuenta que nuestra área de acción abarca tanto la capital federal, que es en sí mismo administrado por el gobierno de la ciudad de Buenos Aires, como 26 partidos que son del conurbano bonaerense. Esta coordinación es muy importante y se está dando realmente muy bien. Pero también es muy importante la coordinación entre las empresas de agua del país. En ese sentido, en la Argentina existe un organismo que es el COFES, que es el Consejo Federal de Entidades de Saneamiento, que nuclea a todas las empresas de agua y saneamiento del país. Y a través del organismo estamos permanentemente intercambiando información, las distintas empresas de las acciones que se van tomando y los resultados, digamos, que cada uno va teniendo, y se aprovecha la experiencia de cada una de las empresas para poder, bueno, ser utilizadas por por el resto de las empresas. Incluso esta cooperación entre empresas se da a nivel internacional. Nosotros estamos actualmente trabajando con algunas empresas de España, de Murcia y demás, intercambiando información y generando conocimiento, que realmente es algo que tal vez, no digo que no existiera antes de la pandemia, pero se ha potenciado mucho y de una muy buena forma. No sé si eso contesta, Graham, más o menos tu pregunta.
Oh, I'm sure you've responded extremely well, Alexandra. That's fantastic. And can I ask you, from Etaqueni's side, what are your responses to Kellyanne? Over.
Can we just repeat that one for me, please? Apologies.
Ednick, sorry,
I got distracted in the call. Yeah.
Do you want to respond to Kelly or answer Kellyanne's question?
I was saying if you can just repeat the question for me, please. I apologize for that.
Please. Kellyanne, do you want to repeat your question for Ednick?
Sure, yeah, it was, thank you. Yeah, it was just a question around coordination and just, whether or not at this stage of the process, you feel that the overall coordination of the response is enabling you to be able to do the job that you need to do to reach the most vulnerable populations, and if there's anything that partners could do to support your efforts to be able to reach the populations in informal settlements.
Okay. No, thank you. I apologize again for that. Some of the coordination happens internally within the utilities, because the response to the problem cannot always be water provision or sanitation provision. Sometimes it's relocating in the communities completely, and that becomes a housing issue, for example. So we need to work together in the different sectors to find the most appropriate way to respond to the problem. But we are fortunate as when we've been part of partnerships like this one and a few others. And through those partnerships, we've been able to learn some ways. I think we learn from each other. The partners learn from us and we learn from them. And I think that needs to continue, because our strengths are not in the same places. For example, when you're talking about engaging operators, maybe we are not so big as a Tegwini there, but we can learn from other countries. When I do travel sometimes to Africa and to other countries, Uganda and other countries, you do realize that I think they're strong and they've made a lot of progress in organizing themselves around getting operators, for example. So ours is very much procurement, a very regulated environment. You put out a tender, you get a service provider to provide you that service. So I think the coordination can help. We can learn from each other. Yeah. Just to speed up processes. So otherwise it would take me long to make the same mistakes. Yeah. That would be my answer.
Thank you very much, Ednick. Mark, can I turn to you in Jamaica? If you've got a quick response to Kellyanne's question.
Okay, just to say that we are not hampered in any way through the national, by the national coordination strategy. In fact, our organization has been given access to move about in a lockdown situation so we can continue to deliver the services that we are expected to deliver. So we are not hindered in any way. We internally just choose to reduce some of the activities that we will do, and that is just as a preventative measures. But we're pretty good as it relates to being able to execute and deliver water supply services across the island.
Hello. Hello.
Graham, we can hear you.
Hello,
Go ahead.
Can you hear me? I'm sorry.
We can.
I think we've frozen. Can I give us a quick feedback on Kellyanne's question? Over. I think we're having some problems with connections and things, but I was just asking if Joachim can give us a response to Kellyanne's question, please.
Me?
Hello.
Graham, might I suggest, I think we're having trouble getting hearing from Joachim. I think we might need to
No,
wrap
no,
up.
I'm here. I'm here.
Joachim, okay, good. Please go ahead.
I'm here.
Okay. Over to you, Joachim.
Bien, yo lo que quería decir en relación a la coordinación y la cooperación, en el caso de Masesa, hemos tenido muy buena coordinación, cooperación entre administraciones, entre empresas de agua, incluso hemos compartido con empresas internacionales nuestros problemas y hemos aprendido mucho. No obstante, tengo que decir que esta coordinación y esta cooperación ha sido improvisada. Aunque los resultados han sido buenos, esta improvisación quizás haya ralentizado, haya disminuido la velocidad en la que teníamos resultados. Por tanto, mi propuesta como técnico de Masesa es que fortalezcamos los instrumentos de cooperación y de coordinación entre instituciones, no solo de agua, sino también de otros sectores, que establezcamos mecanismos reales y eficaces para conseguir resultados ante problemas que son muy parecidos en unas comunidades y en otras relativos al agua. El sector del agua pues, tiene básicamente los mismos problemas en todo el mundo. Disponibilidad del servicio, garantía de calidad, control de fugas, control de pérdidas en la red, el saneamiento. Y por tanto creo, bajo mi punto de vista, digamos, humilde y personal, que deberíamos esforzarnos por crear unos mecanismos eficaces y muy ágiles para que aprendamos unos de otros más rápidamente. La respuesta y los resultados han sido buenos, repito, pero quizás hubieran sido aún mejores y más rápidos con un mecanismo y unas herramientas de cooperación más fuertes. En nuestro caso, tenemos una voluntad como empresa pública de cooperar con otras instituciones, otros operadores de agua. Hemos lanzado un plan de cooperación muy ambicioso que GWOPA conoce perfectamente y estamos abiertos a incrementar nuestro compromiso con el sector, con los operadores que tienen difícil acceso a tecnología, difíciles recursos, difícil acceso al conocimiento por quizás falta de experiencia, decirles que pueden aprender de nuestros aciertos y de nuestros errores. Nosotros, como muchas otras empresas, pues tenemos unos ratios de disponibilidad, eficiencia, etcétera, que son moderadamente buenos, pero ha sido gracias a que hemos cometido muchos errores también en el camino. Por tanto, desde aquí, esa es mi reflexión y mi ofrecimiento como parte del equipo de Masesa, del que orgullosamente formo. That's all.
Okay. Thank you very much indeed. I think really we're having brought to a close now. I think the most important thing is that we must opportunity for us to continue these dialogues. I mean, pointed out by my colleagues, there is the opportunity to continue on Facebook after. There are very, very many questions who come into this discussion this afternoon, and we want to capture all those. And I'm sure there's some way that we can, over a period of time, between Habitat and answer some of those questions. And I think just in summarising what we've heard this afternoon, I think in some ways, if one could take away positive from this terrible crisis, I know for many, the personal circumstances have been awful and very difficult. But I think we've learned quite a lot from this crisis. And I think in some respects, it's helped us to concretise and come up with coping strategies which have probably advanced the levels of access, particularly among some of the disadvantaged communities. It's not technical innovations, but also improvement in governance and in systems. We heard from several other countries that they were, when I say forced to change their procurement rules, something that we all have to live with as a big problem for procurement. But the fact that this crisis has improved the system's operation. I think it's also clearly highlighted the fact the inequity issue of water, and it's made everyone realise that nobody's really immune from this disease. But in actual fact, as our speaker Leo Heller said, it's definitely the poor that are disadvantaged. So I think there's been several good takeaways this afternoon. I won't attempt to go into any more detail of that, and I tell you that we will try and capture as best we can this information. And I would like to just hand over to Julie, our host, just to give some final words of closing. Thank you very, very much on behalf of UN Habitat, on behalf of UNICEF, from all of you panelists, in fact, everyone who's listening in and who's. Thank you so much for this very interesting and productive session. Over to you, Julie.
Thank you. Thank you very much, Graham. Yes, thank you very much. And for some reason, my English interpretation sounds like Spanish, so I'll just turn that off. I won't keep you any longer. Graham, you've made some nice closing remarks there. There's more to come. I just want to tell you that. There's the webinar next week. We're having another one that's focused on emergency responses that we've co-organized mostly with Aqua Publica Europea. But it's also a very inter-regional exchange, and we look forward to many of you and your partners and colleagues and local colleagues joining us for that as well. And then the conversation for this one, we'd like to continue, as we said, on workplace. We thank you very much for your many, many interesting questions. We really hope that we can get to answer these online or through that platform. Yes, thank you very much. That's the slide I wanted to see. We also have our campaign online where we're asking operators to share their what they are doing, the exceptional efforts that they're making at this particular time around COVID-19, but also to collect information on the challenges also they're experiencing. There are a lot of experiences that are shared up there already. You can check out what we have up there, but also feel free to contribute with more. And I will close it. I think you did the polling, so you might want to see that. Let me just share the results so that we know where we're from here. We are fairly well spread around the world. Most are from Asia and Pacific, which is nice to see. And the majority of us are from public operators. And if you count the panelists, then it would increase significantly. I think that would be the majority group, and then multilateral organizations. The way that COVID is affecting utilities in your area the most is that it's causing problems of liquidity. This question of extra costs, reducing cash flows, and also increasing costs is posing problems for longer term. And funding is the identified biggest challenge that is needed over longer term to continue providing ensuring services over the long term. So I will, those are being shared also on WhatsApp. not on WhatsApp, on the workplace group. I want to thank everyone very much, including the interpreters and all of the panelists who have joined us today, and all of the partners in the regional platforms and partners who have helped us out here. We look forward to seeing you again next week, and be in touch with us if you have any questions at all. Thank you and goodbye.
Goodbye. Goodbye, everyone. Thank you.
Thank you. Bye.
Hasta luego. Goodbye.